Hi, I hope you're having a great day. Today I want to talk about the importance of Kegel exercises. Now this is for men and women. It's usually thought that women need to do this, during their pregnancy, post-childbirth, because it strengthens the entire pelvic area. But it is extremely important for men to do these exercises as well. Now, one would think, why do we need to do these exercises when, years ago, these things were unheard of? It's because our lifestyles have become sedentary. It's because our sitting positions are also unnatural. We were never designed to sit in chairs for the kind of time that we sit today in offices and in the comfort of our own home. Like I always say, too much of comfort has also led to a lot of discomfort today. We have chairs, we have tables, we have soft mattresses, all for our comfort, but it's caused more discomfort in terms of leg pains and knee pains and back pain and all of that stuff. Well, let's talk about Kegel exercises. This is basically a clench and release exercise to make your pelvic muscles stronger. Now let's understand the pelvic region is the space between your hips. So for a woman, this is the space between the hips that holds the reproductive organs. Okay, it's very important. It also holds the womb. So especially women going through childbirth, post-childbirth, it does a perfect job if the pelvic region, which is a series of tissues and muscles, are well toned and strong. Now what happens is, because this area gets very weak because we sit too long or we don't utilize these muscles. In the olden days, people would squat a lot more than today. We had the Indian kind of toilets where you would squat and automatically these muscles would get tighter. People sat on the ground. People studied on the ground. People sat and ate their meals on the floor in a cross-leg position. This automatically caused the contraction of the pelvic muscles, and we all know how a muscle grows stronger. Contraction, relaxation. So a muscle contracts, it relaxes, and it gets stronger and stronger. So now what happens is, when we don't use these muscles, they get weaker. Now, especially women, when they go through pregnancy, because of the womb getting heavier and the weight of the child, the weight of the fetus, these muscles, if they're not strengthened, it starts lowering towards the vaginal area, and it can create a lot of problems, from bleeding to, pain. It can affect your period cycle, and you can lose elasticity in the vagina as well. It's extremely important to keep these muscles strong. Women who tend to have a lot of belly fat, if you don't tend to lose that, again, it basically weakens your pelvic floor muscles. Then aging, as we age as well, every muscle in the body gets weak. So by doing certain exercises, we can strengthen them and keep them completely strong. For men, this is extremely important for our prostate health. We need to understand that also men and women, children, teenagers, everyone, when we tend to hold on to our urine, for example, we're in a busy meeting and sometimes we're stuck in traffic and we want to urinate and we have to hold on, and you know how excruciating that pain is to hold on to your urine and basically not pass it at that time. You weaken your bladder muscles, and in turn you weaken your pelvic muscles. So never hold on to your urine if it's within control. You should go immediately to the bathroom and pass urine every time you have the urge to urinate. Extremely important. So it's not just exercises, but it's our lifestyle that determines how strong our pelvic muscles are. Now we need to understand that weak pelvic muscles, it's all connected to your bladder as well. We have something called incontinence. Now this is something that even young women and men are facing today. Before, it was usually senior citizens, elderly people. As we age, we lose control of our bladder. You have to wake up many times in the night to pass out urine. It's called urine incontinence. Now basically, it's because your muscles have gotten weak and they can no longer hold on to that urine. So there's a little bit of pressure and you need to go and urinate, or sometimes you start leaking. So it's extremely important to understand that the things that we do today determines the outcome of what our health is going to be 10, 15, 20 years down the line. So it's extremely important not just to work on your biceps, your abs, your chest, your leg muscles, everything, your internal muscles as well. So it's very important to understand that there are simple exercises that you can do. Now there are certain yoga asanas as well. So I'm actually thinking we do a demonstration maybe a day or two from today. I'm going to have our amazing yoga teacher Nikki demonstrate some of the yoga asanas that can help you to strengthen your pelvic region. We'll do that. But today I'm going to discuss two simple exercises that you can do. The more you squat, so sometimes you just move into a squat position and you sit in that squat position really low with your heels on the ground. You automatically clench and you basically strengthen your pelvic muscle. Now here's another simple exercise that men and women can do anytime and everywhere. This is how you do it. Now, if you're sitting with your back straight, you got to imagine that you're urinating. You have to imagine that you're urinating, and mid-flow, you clench. You just try to stop your urine flow midway. That is the muscle that clenches and stops your urine flow, which will strengthen your pelvic area. Now, a lot of people do this exercise while urinating. It's not recommended because you can contract infection. So it's basically mimicking, the action. So maybe the first time you do it, you want to try it in a hygienic area where you actually urinate, and then midway you stop the urination. So if you're urinating and I tell you to stop urinating, you'll use a particular muscle that clenches and stops you urinating mid-flow. You can do it the first time to understand how the mechanism works, but after that, do not do it while you're actually urinating, because what happens is it can lead to an incomplete emptying of your bladders, and if you don't completely empty your bladder, you have the chance of contracting a UTI, which is a urinary tract infection. So the first time, just to understand the mechanism, you do it. Otherwise, you can be sitting right now and you imagine that you're about to pee and then you clench. Use the muscle that you clench, hold for about 10 seconds and do 3 counts of this. Don't overdo it. Don't overdo any exercise in your lifetime. Anything that's good for you is good in the right proportion and moderation. So to start off with, if you're doing it for the first time, you can do 3 sets of 10 reps each. And that's all that you need to strengthen this muscle. As you get a little bit better, you can move on to 15 seconds and 20 seconds. But just pushing yourself and trying to push your body into holding that clench will actually cause more harm than good. So ease into it, let your muscles get used to this, but this is one of the best exercises. It's called the Kegel exercise, where you can strengthen your pelvic muscle and your pelvic tone. Now, this is even great for your sex life, because especially women who go through normal deliveries, what happens, the vaginal walls tend to get weaker, it tends to get looser as well. So what happens is, by doing this Kegel exercise, you can also strengthen these walls and improve that condition. For men as well, for certain conditions of erectile dysfunctioning, practicing Kegel exercises will allow your erection to stay in place for a longer time. Certain kinds of ED, which is erectile dysfunction. It all comes down to blood flow, and it all comes down to muscle contraction in the human body. So these are simple exercises that you can do. Now, if you're unable to do this Kegel exercise that I just explained, some of you can visit your gynecologist. They have something called a vaginal cone, which they will help you, where they insert it in the vagina and you do the same exercise to hold on to that cone. So you're basically using the same muscle that will basically strengthen your pelvic region. So there are many ways to do this, and maybe 2 days from now, we'll actually do a demonstration of a yoga asana, where you can actually, a couple of them, where you can actually strengthen your pelvic region. So you see, when we align ourselves with nature, there are simple, normal movements. Like I said, if you squat right now and you sit in a squat position for a while, you automatically activate your pelvic floor, which is a collection of tissues and muscles, and you make that stronger. So the more you sit on your chairs and all these comfortable sofas, I'm not saying you shouldn't have comfort in your life, but the more you do it, the more weaker we get, which is why we then need to do more of these exercises. But sometimes you can have the most comfortable sofa in your house, but for once, just sit on the floor. You don't have to always sit on the sofa. But by doing these simple things, you automatically strengthen these muscles. So that's about it when it comes to Kegel exercises. You should be doing this every single day in moderation, because like I said, the more you sit, the more weaker these muscles get. So when you really go back into villages and stuff like that, and you see all these village hospitals, the maternity homes, C-sections are usually unheard of. Like the last doctor I spoke to, she said in the last 4 to 5 years, she had 2 C-sections. The rest of them were all normal deliveries. So I said, how's that possible? Because when you come into urban cities, most of them are C-sections today. So she said most of the women, they're into physical labor and they squat and they cook, they squat and they poop, they squat when they talk to each other. And because they squat, that entire muscle gets stronger and stronger. And when you squat, you can have a more normal delivery as well. So you see, it all comes down to lifestyle, and it all comes down to the way the human body was designed. Have a great day, everyone. Until next time, eat smart, move more, sleep right, and breathe deep.